Welcome to our partner chat on disinfectants. Our speakers today are experts on disinfectant use, and they're here to help put you at ease when it comes to poison prevention. Let's introduce our speakers.
Dr. Theresa Matoushek is a pharmacist and certified specialist in poison information at the Missouri Poison Center. She's earned a Bachelor of Science in Dietetics from Fontbonne University and a Doctor of Pharmacy from Southern Illinois University, Edwardsville. Dr. Matoushek precepts pharmacy students, trains new pharmacists and nurses, leads lectures for healthcare professionals, and applies her diverse background to ensure the best care for poison patients across Missouri. And on the NPIC side, we have Amy Cross, who is a project coordinator at the National Pesticide Information Center, NPIC for short, where she has been providing objective, science-based information about pesticide health and safety since 2014. She has a bachelor's degree in biology, as well as a master's degree in zoology, with special emphasis in rodent ecology. Warren is a pesticide specialist at the National Pesticide Information Center as well. He has a bachelor's degree in marine biology and a master's degree in environmental science, with a focus in entomology and ecotoxicology. So we're about to get started into our conversational expert discussion on disinfectant exposures and safety tips. So disinfectants, sanitizers, and antiseptics, how can we tell the difference between all those three?
I can go ahead and start if that's all right. So I think it's really important to call out that disinfectants and sanitizers specifically are not everyday cleaners. So these are actually pesticides that have added health risks if you're going to be using them in an indoor environment or if you're going to be working with them regularly. So the disinfectants are actually the strongest of all of those three. The disinfectants are targeting viruses, whereas the sanitizers are only going to be targeting bacteria. Disinfectants can do both bacteria and viruses. And what's important to remember about those two is that the sanitizers and the disinfectants are only to be used on surfaces. They're not for use on people. Whereas the antiseptics, that's a little different. Antiseptics are things like hand sanitizer. I know that's confusing because the word sanitizer is used in both, but the antiseptics like hand sanitizer, those are for use on people, and they're not going to be as strong or controlling as much as the disinfectants or the sanitizers will be.
Yeah, I think that's a great point. And the thing is sometimes it's confusing because, like you said, the names, especially in the public, can be used interchangeably, and that can be confusing for people using the product. And sometimes the packaging can look similar to something that you would use on yourself. So especially, I feel like over the last year, some of the packaging even has changed a bit. And so it's always really important to read first and make sure that you've got the right product before you're either using on yourself or your loved one. And then always use those meant for surfaces on surfaces and those meant for used on people.
Great tips. What's the proper way to disinfect a home, and should people wash their hands right after disinfecting?
Another really good question. So with disinfectants, no two disinfectants are the same, which means it is absolutely essential that you read the label thoroughly and understand the product that you have on hand before you start using it, because you can pick up two products next to each other at the market and they can be used in totally different ways and control totally different viruses or control different pathogens in the home. So one of the things you can keep in mind when using a disinfectant is that the CDC has been really clear that it is more effective if you're able to pre-clean a surface with soap and water beforehand. And this is actually something that a lot of labels will have as a requirement as well. Even if it's not a requirement, by pre-cleaning with soap and water, what you're doing is you're cleaning away that grime so that the disinfectant can get to work. So as you're using the product, Consider wearing gloves because disinfectants are not benign. They do have health risks for either accidentally breathing them in or getting them on your skin. So having fresh air, fresh ventilation, air from outside, that's going to help reduce your health risks. Another really important part to remember about the disinfectant is that it isn't just going to work by touching a surface. The instructions include something called a contact time. Contact time is very specific. It's the number of seconds or minutes that the product has to remain wet on that surface in order for it to actually control the virus or to actually work and be effective. Otherwise, you're just adding a chemical and not adding an additional benefit to that. So after the product has been on the surface for the appropriate amount of time, you can also consider whether or not to wash the surface off with water when you're all done. And some products require that, which is why it's important to read the label. And other products might not require it, but it can be a good practice just to reduce future accidental exposures from residues on surfaces. Always washing your hands after you're using any disinfectant is always going to reduce your risks as well.
Another question we get often is, how often do we need to disinfect high-touch surfaces?
Yeah, that's a little bit of a trick question for me because we may not necessarily need to disinfect high-touch surfaces frequently throughout the day, every day, depending on your situation at home, depending on whether or not you actually have an individual that is sick at home. One thing the CDC has been also very clear about is that soap and water on surfaces is effective at controlling some of the COVID-19 virus. So by using soap and water to clean grime or other things that are visibly dirty, or to just do routine cleaning, you can either use soap and water or use a general cleaner. Those things have been shown to be helpful in removing virus particles from surfaces. However, if you're going to be using a disinfectant on a high-touch surface, that might be something that you choose to do more often if you have a sick individual at home. So that's why it's also really important to read the label, because some products can't be used all the time throughout the day. They can't be used as general cleaners. They may only be able to be used once a day. So understanding the product that you have and even how often it can be reapplied, and then partnering that with your use of general cleaners or soap and water, that can be a really powerful way to clean high-touch surfaces often.
Yeah, I think it's important to remember that more is not always better. So a lot of times we think, oh, I really want to get rid of this virus or this bacteria, so I must just do this every hour or something. More must be better, but more is not always better. And so that's something to remember and to follow those recommendations on the package. And then the other thing to remember is making sure that you have good ventilation while you're using these products. So I often think of the bathroom because it's kind of a smaller space. And so it's a good practice when you're using any kind of cleaning product or any kind of disinfectant, any kind of chemical really, is to open up the window and turn on the fan. And that can help give you some good ventilation in those smaller enclosed spaces.
Great advice. Thank you for clearing that up. Here's another thing that we hear at AAPCC, just questions coming in. Should folks spray disinfectant into the air to fight airborne illnesses, or what's the deal with that?
That's such a good question, and it might sound counterintuitive, but that's not how they work. Disinfectants and other pesticides, because that's what they are designed and tested to be used on surfaces only, not on people and not in the air. So if you're using it in the air, number one, it might not actually be doing anything. Number two, you're adding health risks for anyone who's using that space, including the person who's actually doing the spraying, which might be yourself or any kids or family members that are in the area. So that added health risks of breathing in those disinfectants, that's something to remember about, that these are not air sanitizers. These are surface sanitizers or disinfectants.
Along with that, it's important to remember too that some individuals may be even at higher risk because of different types of lung conditions. So for example, someone with asthma, they might be at an increased risk. So you really want to be careful with how we're using these, especially with those who might be at higher risk for those breathing those in.
Those are important reminders. Thank you. So why is it important to avoid mixing disinfectants and household chemicals?
Please do not ever mix chemicals. A lot of us are probably most familiar with not mixing bleach and ammonia because it can create a toxic gas, but a lot of us don't understand that there are several other things in our homes that when mixed together can also create a hazardous substance or a toxic gas. So one of the ways that you can avoid accidentally mixing different products is if you use a general cleaner or you have things that you're using in your house regularly and you're also using a disinfectant, you can consider wiping those surfaces between using the other products and before you use the disinfectant. So if you're wiping those counters off with water, that's going to prevent those residues from mixing accidentally. But really never do mix those chemicals, especially never together as liquids.
Great advice. Speaking of that, mixing disinfectants and how we should definitely avoid that at all times. Can you go over the risks of DIY recipes for disinfecting?
There are a lot of them. I understand that when it's hard to find the product you're looking for at the store, there's this urge to pick up something or use something that a friend recommended. And the risks with DIY or using products that aren't meant as disinfectants and trying to use them to disinfect means that you can be picking up a product that might not have any label instructions for you. That might mean that it doesn't include anything about how to protect yourself. And it could be something that could damage eyes or be harmful to skin or when breathed in, and yet it doesn't have any of those precautions on it. It also isn't necessarily going to be tested for what you want to use it for. So what that means is that, again, you're introducing chemicals into your environment without the added benefit of having them actually control the virus or other things that you're looking to control. It's not going to include that contact time that I talked about before. Contact time, remember, it's how long the surface needs to stay wet for it to actually work. It's not just going to touch a surface and kill the virus. So all of these are added health risks and things that really make DIY disinfecting a much riskier situation than a lot of people realize.
I can definitely speak to that. When we get calls about homemade cleaning products, it can be kind of difficult because we don't know exactly what went in it. We don't necessarily know the proportions, and so it can make assessing those calls a bit more difficult because when we have a product that is on the market, we can pull up, for example, a safety data sheet. We can see the exact ingredients. We can know what symptoms can happen if there's an exposure that happens. And so making those DIY chemicals can make it a little bit more difficult when you do call for help because sometimes it's just we're not clear on what exactly is in the product.
Great, thank you. Personally, I grew up with seeing family members mix bleach and soapy dishwater. Can you tell us, what we should do, not do with mixing bleach?
Yeah, there is very good guidance about how to wash dishes from CDC and other authoritative resources with soapy water. And if you have a dishwasher available to you using that dishwasher, it's going to add that really hot water element to it. But it's hard to remember if we use bleach in our everyday lives that, it still does have added health risks. So not adding bleach to soapy dishwater is going to reduce your risks, and the dishes are still going to be cleaned effectively with just soap and water.
Great, that's helpful. So what's the right way to go about sanitizing and disinfecting before and after you prepare food?
I think a lot of people know what the everyday food safety steps are, and it doesn't necessarily have to be complicated with adding any kind of disinfectant to the mix. So for sanitizing surfaces or for proper food handling, things like washing your hands before, during, and after the food handling process is very important. Also, if you're going to be using, countertops or cutting boards or any kind of utensils, hot soapy water is guidance from all of the reputable organizations, essentially. And if you're going to have produce like fruits and veggies, running those fruits and veggies under running water, actively running water that's cool water. And if you have a scrubber to scrub fruits and veggies, and if that makes sense, I know for some soft things like strawberries, it might not make sense. But if you have a type of food that can be scrubbed with a scrubber, that's going to help remove pathogens or other things from the surface of the food. So all of those general tips still apply here. But then the added tip is never to add soap, disinfectant, bleach, never to add any kind of sanitizer or other chemical product to your fresh produce when you're washing it. Using clear, running, cool water is basically the best guidance that the FDA can provide.
That makes a lot of sense. It's after Labor Day, kids are going back to school. Disinfectant use is important for kids too, especially, in these times. So what are some general tips that parents, caregivers, and teachers can use?
Yeah, so first of all, and most importantly, reading and understanding the label for the product that you have. This is going to tell you exactly what locations, what procedures to follow to use that product properly and to help to minimize the risk to you and your little ones. So if a product is going to be used on a surface that is touching food, check for specific instructions on that label that might describe how best to use that on the food contact surface. Sometimes that may mean after it's been applied on there, cleaning the surface again afterwards, help to reduce that risk further. And as far as school is concerned, if kids are going to be eating at their desks, think of that surface as a food contact surface. So one way to kind of prevent any kind of exposure with that is to use a barrier. So considering using like lunch mats at their desk if they're eating there on desks that are going to be disinfected, that's another way to reduce their risk. And first and foremost, keeping children away during that application and then waiting until the product has either dried or been fully cleaned before letting them back into that area where the disinfectant has been used. And also, do not leave disinfectants unattended. Little ones can find them very quickly. And also do not transfer those to unmarked bottles, including water bottles, just because they can very quickly find that and get themselves into a lot of trouble. And then also after you're done using that disinfectant, store the leftover product in a location that's out of reach of children. And finally, do not use the disinfecting wipes as either hand wipes or as baby wipes.
I think those are great tips. I can definitely relate to the putting them in a different container. That is something that I feel like is inevitable to lead to a call to the Poison Center. So many of our cases start with something that was put into a beverage container. So if that's a water bottle container, Gatorade container, or even just a beverage cup, many of our exposures start that way. It can be confusing to an adult because it looks like, something may be clear or something might be colored in a Gatorade bottle. It looks just like something that you would drink. And then they forget that they put something in there, or someone else comes along and they get an exposure. It's also confusing for kids too, because they're used to drinking out of beverage cups, of course, and they won't necessarily check something before they drink it. They just go up and they're curious, they're exploring. Something looks yummy, it might be brightly colored, and they'll drink it. And so it's really dangerous to put those chemicals into a beverage container. That we do get a lot of calls about that.
Thank you. That's so helpful, just to avoid, putting things in beverage containers, keeping things in their original packaging, and also just remembering to not leave disinfectants out. We can't forget about babies and toddlers. What if a baby or toddler gets disinfectant or sanitizer on their hands and they lick it? What should the caregiver or teacher do?
Yeah, so the first step, of course, is preventing further exposure. So rinsing the area, whether it's hands, getting water for them to kind of drink to kind of rinse out the area, that's going to prevent that further exposure to the little one. And then the next step, of course, would be calling poison control, and they're going to be able to get you additional health and emergency treatment advice.
Yes, definitely. So I'm glad you put the plug in to call the Poison Center. We, again, just like you said, recommend rinsing the area. But one thing that's good is that a lot of these accidental exposures, for example, in kids, we can keep them at home and watch for symptoms. So we will provide that follow-up as well. So you're not left wondering what will happen. We will provide follow-up calls to individuals to make sure that there aren't any symptoms that are happening. So we can really provide that expert advice for the next steps to take. So it's always recommended to call the Poison Center.
Going back to school-age children, can kids help with cleaning and disinfecting a classroom or a home?
So it's best, when in the classroom or at home, it's best to leave the cleaning to the adults. Do not let children under 18 to use disinfectants. This includes not letting them use even disinfecting wipes. Even older kids are still at risk of exposure to disinfectants. So this should really be handled by the adults in the home. So even if you're at home and they're wanting to help, finding other ways to let them, assist, whether it's picking up things around the house, those, things that you're wanting to clean, helping do something like that is going to, lead them to be helpful, but not, cause a possible exposure to something like a disinfectant if they're actually using it.
Yeah, I think we like to think that those disinfectant wipes are no big deal, but I do get calls with maybe kids are using them or something, and then they put it in their mouth just because kids are curious. Again, everything goes in the mouth, and so, or maybe the disinfectant wipe is left on the counter, and a kid comes up and thinks it looks fun to play with, and then inevitably it'll go in the mouth. So that's an important point to remember.
So true about kids being curious. Another thing that could help teachers and caregivers at home is just displaying the poison help number. You can call 1-800-222-1222 just to get poison help stickers and magnets from your local poison center.
Yes, we're always happy to provide poison prevention materials, and your local poison center will be able to help you figure out how to get those. And to reach your local poison center, it's very easy. You just call 1-800-222-1222. And there are a lot of other poison centers. A lot of poison centers now have social media pages too, and so follow your state's poison center as well for tips. That's a good way to interact with your poison center as well.
And we have a lot of other good resources related to disinfectant safety as well. A good starting point is our disinfectant and COVID-19 hub page. On this page are a lot of different types of resources that may be relevant and useful, including fact sheets. We have some frequently asked questions. We have infographics on a number of topics, as well as different web pages related to the use and risk from disinfectants. And in addition, we also have a infographic about using bleach at childcare sites that's on our outreach page.
Oh, it's awesome that we have resources on both sides for disinfectant use. It's great. So can you guys give a quick summary of top tips to help prevent a poisoning from disinfectants for all ages?
So I would say read the label first. A lot of times we get calls about questions after the fact. So it's always good to read the label first so you know how to use it, and wash hands after use, like we had mentioned. And then most importantly for the young children, of course, keep it up and out of reach. Most of the time exposures occur while the product is in use. And so making sure that right after you're done using it, you put it up and away and out of reach of kids. And be cautious while you're using it as well. Be mindful of where your kids are at, maybe putting them in a different area while you're using the product, just because, again, those exposures happen while the product is in use. And then making sure that we're supervising older kids. And then that no transferring of containers. Again, that's a big reason why people call us, because it was placed in a separate container. And that makes it more difficult because we may not know what was in that product. You know, the original container is long gone. And so it's always good to keep it in the original container.
And also, I mean, it's important to note that not all situations are going to be something where you have to necessarily use disinfectants. Like Amy mentioned, soap and water can be effective in reducing and removing bacteria and viruses from different types of surfaces. In addition, if you're able to Like if you do decide to use a disinfectant to control bacteria or viruses, like Theresa said, read and follow that label. I mean, we reiterate that multiple times for a reason, because it's one of the most important like notes you can kind of take away from this. Again, take note of that contact time that's listed on that label, and that's the time it has to remain wet on that specific surface for it to be most effective. In addition, reducing your risk from disinfectants by wearing protective equipment is one way to help, like I said, reduce your risk. Wearing gloves, using goggles, or wearing long sleeves, that's going to help to limit any chances that's going to splash onto bare skin. And again, minimizing the risk to children by keeping them away from that area during the application, and then once it's either dried or been fully cleaned, before letting them back in to that area. And then if you have questions about disinfectant safety or the risks related to other pesticides, also call us at the National Pesticide Information Center at 1-800-858-7378, Monday through Friday, 8 a.m. to 12 noon Pacific time, or send us an email as well.
Thank you so much to our experts for such an informative discussion. That wraps it up. If you have any questions, you have 2 numbers you can call. You can always call Poison Help anytime, 24/7, 365, as well as the number Warren Hanson just mentioned from NPIC. Have a great day, everyone.
Thank you very much.